Wastewater surveillance for antimicrobial resistance fills some really important gaps in our knowledge. Right now, the surveillance we do for AMR is typically all coming from cultured clinical isolates, and that really biases our knowledge to infections that are happening in healthcare settings. And while that's really important information, it's only one part of the picture. So wastewater surveillance is a cost-effective way to get population-level data. That can be very targeted. We can look at wastewater coming from a single ward or unit in a hospital, or it can be very broad. We can look at municipal level wastewater that's coming from an entire community. And importantly, wastewater allows us to get data from the community setting as well as healthcare settings. And if we have surveillance nodes in different types of settings, for example, at Ginkgo, we have surveillance nodes in airports, in agricultural settings, in hospitals. That allows us to start to characterize how pathogens and resistance genes are moving between those different settings. There are both technical challenges and challenges, I think, with understanding how to interpret and use the data. So on the technical side, one of the big examples that comes to mind for me is that with metagenomic data, we often can't make associations between the resistance genes that we're detecting and the bacterial organisms that they're associated with. For example, in a sample, we might say we're detecting Staphylococcus aureus and the gene MEK-A, but what we'd like to say is we have MRSA. And that's just kind of a limitation of most types of sequencing approaches. And that's a place where if we can start to make those associations more accurately, that's really valuable. So we're working on that both on, there's new approaches coming out that help us to do that on the wet lab side. They're expensive right now compared to other sequencing methods. And there's also ways to potentially get better at doing that bioinformatically and from a statistical perspective to make those predictions. The second big challenge, I think, is in the, like I said, data analysis and interpretation. I think it's hard to overstate the data that comes back for AMR, how much more complicated the data is compared to when we're just doing surveillance for a pathogen like SARS-CoV-2. So we get this huge list back of hundreds of resistance genes and a whole community of bacteria. And I think figuring out how to take that really complex data and turn it into something that is useful and informative to decision makers is a challenge. And that's a space where we've been finding it really valuable to work in partnership with the end users for the data. So getting people from the technical side, the bioinformaticians, the epidemiologists, at the table with people in hospital infection control, for example, to understand what do they want pulled out of this data that's going to actually be useful. One of the areas where it's the most tangible right now is in healthcare settings like hospitals. We're really excited about the idea that wastewater surveillance could help hospitals reduce healthcare-associated infections and to make decisions regarding antimicrobial stewardship. Imagine, for example, that when you have wastewater surveillance, which can capture things spreading asymptomatically, do broad population surveillance, that this could help to inform when hospitals might want to turn on heightened infection control procedures or more targeted surveillance methods like sequencing or testing swabs, for example. This is a vision right now. We're not quite there yet, but we really want to move towards having something like a unit-level digital antibiogram from wastewater data. So from wastewater, you could get a snapshot of the abundance of different resistance genes binned by drug class. And that could help hospitals make decisions about which antibiotics to prioritize for frontline use. Right now, this is mostly all kind of in the vision category. We're starting some really large pilots to look at wastewater sequencing and PCR detection for pathogens in healthcare settings. And then in these pilots, we're going to be correlating that data with patient electronic health record data and also hospital operations data to try to get a more definitive answer to where this type of data can be useful to hospitals.